I'm Jessica Hosfield. I'm pleased to be here today. I am out of my element. I'm not a public speaker, so please bear with me if I use some notes and take a deep breath every now and then. So this video you just saw was something we were asked to be a part of about 5 years ago. We were glad to do that, and I wanted to show it today because I think it's a great introduction to our story, and I like showing off how cute Ellis is also. In the video you met Greg, my husband, and let me just say that he is the best husband, the best friend, the best helpmate I could have ever asked for, and the story of how God put us together is a really great one, but that's going to have to be for another time. It's a really long story. So anything I say today about my story is really our story, because we are 100% in this together, and that is a great blessing, and I appreciate my husband and I appreciate my marriage. But this is a women's conference, so I'm going to talk about myself a lot today. So in the video, you also got to meet Ellis, our precious daughter. She was 3 years old at the time in that video. And she was sort of in a transitional period with some of her health issues and some of her therapies. But she was healthy enough to go out in public, and she was healthy enough to go travel with us and go places. So that was great. And you're going to hear all about her and how well she's doing in a little bit. So she's not here today. I know many of you have asked. She's not here today because I knew I was going to be nervous and I knew I was going to cry. And I was like, I can't handle it if she's here too. And then my mom is also not here for the same reason, because I was like, I love you, but you can't be here because I can't handle that too. So she's going to watch the video later. So hi. So I'm a native of Frankfort. Greg and Ellis and I are longtime members here at Forks. And Greg and I are both architects, but our newly assigned roles as parents of a miracle baby supersede any kind of professional credentials we've ever earned. And she truly is a miracle. I don't just say that as a form of speech. She's a miracle, because a miracle is something that only God can do. Amen. In 2009, after 6 years of marriage, I found out I was pregnant. And we were beyond excited, of course, and we told our parents immediately. I started buying baby clothes. I bought all the baby books. I started reading the baby websites and blogs, and I started decorating the nursery in my head, and I was like, we got to move to a bigger place, because we lived in this tiny little one-bedroom condo in downtown Lexington, and I was like, we need room for a baby, and I went and bought my prenatal vitamins, and we were just so excited. And then I had a miscarriage, and more precisely, our baby died. And I think the word miscarriage doesn't quite carry the same weight sometimes. But that's what happened. And we grieved for that baby. And we still do. And I still do every day. And it's not something that we proper Southern ladies talk about a lot, I think, because it is really painful and it's hard to talk about. But it happens to so many families and so many women, and I think it would be good if we talked about it more, but not today. So later that year, I found out I was pregnant again. We were very excited, for sure. But this time there was a cloud of anxiety hanging over us. And we had a promise in our hearts from God that he was in charge of the situation. And we believed beyond a shadow of a doubt that he was in control of everything. And there's another really, really long story about how Ellis got her name, how God led us to that decision to give her this name, all the things that were put on our hearts before we even knew that we were pregnant with Ellis, to prepare us for the things that were going to come in these years. We don't have time for that today either. That'll be another story. But I will say that the name Ellis means Jehovah is my God. And that's not an accident. So at our 20-week ultrasound, we found out we were having a baby girl. The ultrasound tech was trying really hard to hide the fact that she was freaking out, and we didn't know what that meant. So she left the room, and we knew something was wrong. And so I'm just going to pause here for a second to say that there are so many examples throughout this whole story of the way God has orchestrated every step of our journey. And he's been present, and he's been real, and he's just been carrying us through every second. And I don't have time today to list all of that, but this moment that I'm about to describe was one of those where God was so real and present. So my regular OBGYN had said, hey, my ultrasound equipment in my office is kind of out of date. We've ordered new equipment. It's not come in yet. I'm sending all of my patients over to a clinic at UK to get ultrasounds because they have better equipment. So we showed up that morning at the high-risk pregnancy clinic at UK Hospital. Turns out that's exactly where we needed to be. So we were in the room. The ultrasound tech freaked out, left the room. And Greg and I just looked at each other, and we knew something was wrong. And we didn't know what it was. And we waited probably like 2 minutes, but it felt like 2 hours. And I started to cry and worry, and he was trying to calm me down, and he was like, let's just wait and see what they say and see what's going on. And I began to pray in my head one of those like not at all planned out or eloquent prayers where I couldn't talk, I couldn't think, I couldn't make the words in my head, and all I could get out in my head was just, God, just help, because we were so scared. And as the doctor opened the door and walked into the room, I heard a voice, not in my ears, but in my heart, as clear as I'm talking to you right now, a voice in my heart that said, this is going to be really hard, but it's going to be okay. And so the doctor came in. She had looked at the ultrasound from the other room, and she said what she saw was a really large mass, some kind of tumor, some kind of big, massive thing on the baby's face and neck. Then she said a bunch of other words I don't remember because I was so upset. All I got out of that was that we were going to have to go to another hospital because it was beyond anything they could handle at UK, and it was very rare. And so after the initial shock kind of wore off and we settled down a little bit, this is what we knew. So if, big if, the baby made it to term, she would be born with this massive deformity. And it was approximately the size of her head, which is hard to imagine. The mass would compromise her development, her breathing, her swallowing, and anything and everything else in the head and neck region. Ears, eyes, there's no way to know. There was no way to know what kind of mass this was until she was born. And the two most likely possibilities of what kind it was were not fatal, but their after effects could be. And so our doctor was able to tell us this on the spot because she had recently come to UK from Children's Hospital of Philadelphia, CHOP, which is the number 3 children's hospital in the country. It's unlikely that any other doctor that day could have given us the same kind of information there just on the spot, because it's not something UK handles regularly. So we know we were in the right place at the right time with the right person. We left the hospital. I did the hardest thing I've ever had to do in my life, and that was to call my mother and to tell her what was going on. And it was horrible because there was just so much we didn't know. We didn't know what was going to happen. And by the way, the second hardest thing I've ever had to do in my life was 5 years before this, when I was 25, and to tell them that, to tell my parents that I had been diagnosed with multiple sclerosis. And that would have been difficult for any parents to hear, of course, but my parents took it especially hard because my father has been living with multiple sclerosis since he was 25. It's an evil disease, but he's doing really well. He's doing miraculously well. And I'm doing very well. And I thank God every day for sustaining us both, but more about that later. So within days, we were referred to the Fetal Care Center at Cincinnati Children's Hospital, the number 2 children's hospital in the nation. And I can say without reservation that the team at Cincinnati Children's Hospital is the reason that Ellis is alive and well today. Like I said in the video, God has just put the right people in the right place at the right time for us, and over and over and over again. And we could be here all day that I could just list those times, but the right doctors, the right specialties, the right medicine that just came available that week. I mean, it's incredible. So we began going to Cincinnati every week or two for tests, ultrasounds, any kind of test you can imagine, sometimes spending the night. Sometimes we were just so inundated with information, we would leave and we would drive all the way home back to Lexington and not even talk. We wouldn't even say a word or turn on the radio because we were just so numb by that point. And what do you say? There's nothing to say. So the doctors still didn't know exactly what it was, but they had to prepare us for every possibility. And it was a really tense and exhausting time. But we pretended to be as normal as possible. So we both kept working. I would go out on the job sites with my hard hat and my safety vest and my big pregnant belly. And I'd go up and talk to the contractors and I would be like, yeah, I'm a lady architect. And I'm pregnant, so I still have authority. My friends had baby showers for us. I bought baby clothes. I read all the baby books and the baby blogs. And we let ourselves get excited, but it was also painful at the same time. And each week that Ellis grew closer, 1 week closer to term, I think we got a little more confident in her ability to be born and our ability to do this. And I was hospitalized once while I was pregnant, but Ellis turned out to be stronger than me even before she was born. So we were released and could come home. Our care team in Cincinnati recommended that we move up there to Cincinnati, which was not something we were planning on, but we did it. The best case scenario was that she would be born. She would have surgery to remove the mass. She would spend a few weeks, months, years in the NICU. Up there it's called the RICNIC. And then be able to come home. And I can't even talk about the worst case scenarios. So we moved to Cincinnati. And here's another example of just how present God has been through this whole situation. God provided everything we needed financially, physically, spiritually. Greg and I worked for the same architecture firm at the time. And when I told our bosses the situation, they were so understanding and so accommodating. And they said they would do anything they could to help us. And so the Lexington office was actually a branch office. The head office to this huge firm was in Cincinnati. So special arrangements were made for us so that Greg could keep working while we lived in Cincinnati. And that meant that we could still pay our bills. Most importantly, that meant that we could keep our health insurance. And I have so many friends, so many moms that have been through similar situations, that have been through a horrible time, through the NICU days, separated from the rest of their family, out of work, the entire family often out of work, with or without health insurance, nowhere to live, nowhere to stay, no clue what to do, because nobody ever tells you what to do in this situation. There's not a guidebook. You're just sort of thrown out there and say, figure it out. So, special blessing. Greg could keep working. We could keep our health insurance. The architecture firm that we work for, a big firm, they designed the new Ronald McDonald House in Cincinnati, where we ended up living for almost 4 months. And they also designed Cincinnati Children's Hospital. So even though I was not the architect who personally worked on these projects, I had been there. I had been to both of these places professionally for tours and to see other things. And so I was familiar with the spaces. I knew some of the people. And now I was coming into them as a patient, which is a completely different experience. So our care team moved us up to Cincinnati. It was supposed to be 3 weeks before my due date. It turned out to be 3 days because I went into labor. But everything was prepared ahead of time. Everything was completely planned out. It was very well orchestrated because that's what Cincinnati Children's does. They prepare you for everything. So Ellis couldn't be born in any normal way because she could not breathe on her own. They had determined that before she was even born. So her birth had to be a form of fetal surgery. That's called an exit procedure. She had to be intubated before she could even be delivered. And there were literally 30 people in the delivery room. I had 3 surgeons. She had 3 surgeons, plus everyone else that has to be there. My parents, Greg's mom and her husband, drove up there in the middle of the night to be there and stay there with us. And the surgery took about 2 hours. And later, one of the doctors told me that he just made up a time to put on her birth certificate, like the time of birth, because he was like, everybody was too busy to look at the clock. We have no idea what time she was born. It was sometime between like 10 and midnight, but whatever. I'm just going to write down a number. And I was like, that's fine. After the surgery, Ellis was immediately taken to the RICNIC. And I was inpatient in a different part of the hospital, and I did not even get to go see her for about the first 36 hours. And so Greg, bless his heart, he was running back and forth between the RICNIC and my hospital room, and the RICNIC and my hospital room, and he would take pictures and then come show them to me, and then he would go back to her and then come back to me, and he had a hard time. So I don't remember a lot. I was on lots of drugs, lots of drugs. And because I do have multiple sclerosis, special considerations had to be put in place for me. I could not be on the normal kind of drugs that you would usually have with this kind of surgery. And there were just other technicalities like that that kind of slowed down my recovery a bit. And so that was a really hard time because I was inpatient. I couldn't walk. I was in a wheelchair, having to go see her. Then I would come back to my room, but I wanted to be with her, but I was scared to be with her because I didn't know what I was doing, and it was just a really confusing time, and I don't remember a lot of that. So, but I do remember the first time I got to see her. She was about 36 hours old, and we weren't allowed to hold her. Nobody could pick her up or hold her for about the first 2 weeks. And so that was very hard because she was in her NICU bed, and there's just tubes everywhere and monitors, and she was intubated and she was sedated. And, at this time the mask was still there, and I wasn't allowed to touch her, pick her up, but the nurse did let me just put my hand on the top of her head and talk to her. And that was it for about the first 2 weeks. However, when Ellis was 6 days old, she had her second major surgery. This baby, she's 8 years old now, and she's had more surgeries and hospitalizations than most people do their entire lives. But anyway, 6 days old, second major surgery. This was to remove the large mass, and it was still about the size of her head. So it turned out to be a lymphatic malformation, and it was an 11-hour surgery. And the doctors removed 99% of the mass, and her prognosis was very, very good. That day was simultaneously like the best day of my life and also the worst day of my life because of the stress of it. It was just all consuming, and I was so sick still. And I had been dismissed from the hospital at this time, and I was so sick. And some of the nurses took pity on me, and they let me, during this 11-hour stretch, they let me go lay down in a hospital bed that I didn't even belong to just because they were like, you're going to pass out. You need to go lay down. So I remember just laying there in some strange hospital room and just praying and crying, and finally got to just sort of a numb point where there's nothing else you can do at that point. You pray. You just give it to God. So Ellis's recovery was rough, but she did recover from that. She got to the point a few weeks later where the doctors gave her a chance to breathe and swallow on her own, but it soon became obvious that she couldn't do either one of those things safely. So when she was about a month old, she got her G-tube, which is a permanent feeding tube. And when she was about, I don't know, I want to say 9 weeks old, she got her trach. And a trach is a plastic tube that goes through the neck into the trachea to keep an airway open so that she could breathe. And so that decision to get the trach was, it was a very difficult one for me because I knew she needed it, but it was hard for me to accept because at this point we had been living in the hospital and at the Ronald McDonald House for months. I had seen other trach babies. I had seen other families in the Ronald McDonald House caring for children with trachs, and I knew what that meant for her. The good side was that meant some independence for her. She was going to be able to get up, run around, play like a normal baby, and breathe. But the bad side was that it was going to also hold her back in a lot of ways. She wasn't going to be able to speak. They had already told me her airway was so compromised they had to upsize the trach to completely block the trachea, so she would not be able to speak for an indefinite period of time. And I saw the other families giving trach care to their other children, and I thought, I cannot do that. I cannot do that. I am not a nurse. I don't know what I'm doing. It's too dangerous. I can't do it. But the doctors walked me through it. The nurses walked me through it. And this is another time that God really spoke to my heart. And this verse became something I just clung to daily. My grace is sufficient for you, for my strength is made perfect in weakness. 2 Corinthians 12:9. So at that time, we were still living at the Ronald McDonald House. I'll talk more about that in a minute. Greg would get up and go to work every day. I'd go to the hospital all day. He'd come home from work to the hospital. The hospital. We'd grab a quick bite to eat, stay with Ellis all evening, take a little nap somewhere, and get up and do it all over again. And we had 3.5 months of that. And it was such a hard time, but we had so much love shown to us. Our church family was amazing. We had so many visits, phone calls, emails, cards, care packages, people just showing up unannounced, which some people don't like, but I kind of like that. So they just showed up saying, we love you, we're here for you, we're going to take care of you. And that meant so much. I had friends who would just come sit at the hospital with me for hours. Steph. And friends who would come pray with me, bring me food and books. Amy? Our parents were amazing. They were all still working full-time at the time, but they would take off work. They would come spend the night with us when they could. They did everything for us. So we came home with Ellis after 3.5 months, and that's when things got scary. Up until this point, we had doctors and nurses around us and therapists, and then we brought her home, and it was just us. Whew. And I mean scary. So before we could even bring her home, Greg and I had to go through 2 weeks of classes at Cincinnati Children's Hospital to learn how to take care of trachs and G-tubes. We had to learn trach CPR. We had to learn how to change a trach. We had to learn how to suction a trach, clean a G-tube, change a G-tube, what to do if the G-tube comes out, what to do if one day Ellis pulls her trach out and hands it to me, which she did several times. What to do if you're on the road somewhere, not near a hospital, and the trach gets plugged and suction doesn't work, and what do you do? And just every disaster scenario you could imagine. We had to practice. We had to pass little tests. They would give us tests to, like actually demonstrate on her we knew what we were doing. The only other person that went through that training was my mother, so that she could also be a caregiver for Ellis. And we really, really appreciated that, and we really needed that. So we went through these weeks of training. We came home, and we were just in absolute panic mode. We had been trained, but you can never be fully prepared for the fear that strikes you in the middle of the night when your child can't breathe. And so we had to just rely on that training, comfort each other, calm each other down. You can do this. We're in this together. I remember the first night we brought her home. So we came into the house. It was like it would be funny if it wasn't so scary. We came home with like a traveling circus worth of stuff, equipment. We had a big feeding tube pole. We had suction machine. We had humidification machines. We had emergency bag, all the normal baby stuff like diapers and all that kind of stuff and all that stuff. And our tiny little 700 square foot condo in downtown Lexington, packed wall to wall. There was like a little path you could walk through like this between all the boxes and all the equipment. And I tell people it was like living on a boat. Like everything had its place. And if you took one thing off the shelf, you had to put it back exactly where it came from because there was no room anywhere to get anywhere. So we came home with all this equipment, wall to wall, boxes and equipment and stuff. And poor Ellis, poor baby Ellis, she had been in the hospital her whole life. She had no sense of day and night. She was on no sleep schedule. She was so confused. And so I remember that first night we brought her home, had a little crib set up for her in our bedroom. And she was fussy. We were exhausted. We wanted to go to bed. She was fussy and crying, and I was trying to comfort her, trying to calm her down. But when she cried and got all upset, that meant she needed more trach care, more suction and stuff. And so it was just sort of the cycle. And so after a couple of hours, I just told Greg, I was like, go lay down on the couch, go to bed. One of us has to be coherent, responsible adult tomorrow. That'll be you tonight I'm going to sit here in the bed. So I just propped myself up on pillows in the bed, pulled all the equipment over around the bed. I put the suction machine in the bed next to me and just put Ellis and all of her tubes and wires and monitors, just laid her on my chest and just cried. Because what else could I do? So I remember that first night. I did not sleep at all, but I cried a lot and I prayed a lot. And Ellis eventually slept a little. Oh, hallelujah. So there's a scripture I would like to share now, which has gotten me through many, many hard days. I think they're going to put it on the screen. Because you are my help, I sing in the shadow of your wings. I stay close to you, your right hand upholds me. Psalm 63, 7 and 8. And on different days, this message has meant different things to me. Some days I really need the help and the holding up. And then some days I need to be reminded that I'm allowed to sing. I can't really sing, but sing. I have nothing to fear, and I can sing, and Ellis can sing through this. And so the last few years since we brought Ellis home are blurry in my mind. It's a swirl of really scary times, surgeries, hospitalizations. For years, Greg and I would sleep in shifts because someone always had to be able to care for her and watch her. So we were both generally exhausted and grumpy for years. And I got so worn out, and my anxiety just spun out of control, and I started having panic attacks. And the worst thing for MS is stress and fatigue. And I had both of those things really, really big. And so then I started panicking about what if I get myself so worn out that I have an MS flare-up, and then I get sick, and then I would worry about that more and panic, and then I would get sick, and then I would panic about getting sick, and then I would get sick because I was panicking. And it was just this really vicious cycle that was interrupting what I needed to do to care for Ellis. And so, again, we don't have time for all this today. Eventually, I did get some help and guidance for my out-of-control anxiety. And I recommend that anyone going through that kind of situation, anyone going through that panic, anyone who's having anxiety and fear beyond what you can handle in your normal daily life, it's okay to get help. And it's your responsibility to get help because other people are depending on you. And if you want to talk more about that afterwards, I'm right up here. I'm in a red jacket. So you're fine. So my mother's the best mother in the world. She went through the hospital training. I told you about that. She would come and help out as much as possible, sometimes spending the night. And we had some in-home nursing hours through our insurance. We had 8 hours a month, which is not really a lot. But I was glad to get it. And usually I used my 8 hours a month to sleep or go to the grocery, or sleep then go to the grocery. And that was pretty much the only two things I did during those 8 hours. So we had wonderful friends who would come visit, bring us things we needed. And I could not drive Ellis in the car by myself because she needed constant trach care. So we had friends who would come also and drive us to doctor's appointments in various places. And so I've described a lot of really tense, scary times, but we also had really happy, amazing times. And this is where I talk about how we can sing. When she started to walk on her own, and when she started to be able to talk to us in sign language back, she was communicating with us. That was amazing. It was amazing. And Greg and I made the very conscious decision to give Ellis as much of a normal childhood as we possibly could. And that was really hard work because there's nothing normal about our situation. But we wanted to teach Ellis that she's not defined in any way by her diagnosis or her limitations. And so most days we would do therapy at home. We'd play, we'd do normal baby stuff, and then, okay, so we have to stop and we have to do trach suction, or we have to stop and do a tube feed, but we're still going to do it. We're still going to play. We're still going to go outside and swing. Even if I have to carry the suction machine with me outside, which I did, we're going to do this because she is a normal baby in every way other than this physical problem that she's having right now. So we took her on little day trips. We had friends, our neighbor, Joe and Maureen. Our neighbors were fantastic, and they would come over and drive me places. I would say, let's go to the orchard. Let's go to the farmer's market. Let's take her to the children's museum. And so I would load up like a gallon of hand sanitizer and the suction machine and the trach and the trach bag and the emergency bag and the suction bag and the diaper bag, and we'd load all this stuff into the car, and they would drive me to the orchard or whatever. And we would have a fabulous day, and I would stop every 10 minutes, and I would do suction, and I didn't care who looked at me or what they thought I was doing, because my baby's going to the orchard, we're doing it. I was determined, we are doing this. So when it was time for Ellis to go to kindergarten, the only way she could go is if I went with her. So I went to kindergarten, and it was some of the best times I can remember, some of the best times I've seen with her interacting with other children. I was so glad we did that. So bring it to present day. I know I'm running out of time, but she's 8 years old now. She is the healthiest she has ever been. She got her trach out about 3 years ago. She got the G-tube out a little bit before that. She still has some medical challenges. Oh yeah, let's clap. Let's do it. So she is thriving, and she is blooming. And I think because she's grown up with so much difficulty, she is patient, and she is kind. She is tough as nails. And, she has those times when she might have a rough couple days, but she's remarkably resilient. And, she'll tell me when she's scared. She'll tell me when she's tired. She never complains. She never argues. She never throws a hissy fit. And I admire her so much, and I want to be like Ellis when I grow up. But, she's an 8-year-old, a normal 8-year-old in every other respect. She loves her Barbies. She loves her puppy dogs. She likes playing dress up. She likes doing ballet. I wish I could say, oh, look, everything's great. Everything's fine. The end. We are at a place where we can kind of pause and reflect a little bit, but our story is far from over. Ellis is doing really well, but she still has some medical issues that we have to stay on top of. She still has facial paralysis, speech difficulties, lots of scars, occasional lymphatic flare-ups with bruising, swelling, can affect her ears, anything here in this region, throat, neck, ears. She still has frequent checkups, tests, exams, and procedures in Cincinnati. She's going to have a major surgery this summer and another really extra major surgery the following summer or the one after that. She handles all this with grace, much, much better than I do. And she continues to have speech therapy, and she handles very well the stares and the questions that she gets from other kids and sometimes even other adults. We never mind people asking questions. She's learned to say, when a kid runs up to her and says, "What's that?" On a scar or something, she'll just say, "It's a scar, I had surgery," and then just goes on about her way. And whereas I would probably break down into tears on the floor and just couldn't handle it, but she's so strong that way. And these are things she's going to have to deal with her whole life, but I feel like she's got a really good foundation, and I'm so proud of her. And so what am I doing now? Well, I'm super busy. I appreciated Allie's talk this morning about some of the clutter that I know I could take out of my own life. But everything I'm going to tell you about right now is not the clutter. This is the important stuff, the priority stuff. So I have lots of friends in similar situations that I've met throughout this journey, the NICU, the Ronald McDonald House, other friends, families. Every circumstance is unique, but what all of us parents, especially moms, have in common is the ferociousness with which we advocate for our children and our ability to turn our experiences into something positive for another child or another family. My friend Heather is here today. We're in a group in Lexington called the Mighty Moms. She is super busy also, super awesome, super mighty. I don't know where she found the time, but I admire her so much because she has turned her experiences through the being a parent of a special needs child and a child with special health care needs into something positive for other people. She wrote this book to provide support and knowledge for other families dealing with chronic illnesses and disabilities. And she interviewed me for this book and some of the other Mighty Moms, some caregivers, some healthcare providers. I'm just in awe, and I'm so proud to be her friend. I will forever and always be Ellis's full-time mom, but I'm back to practicing architecture, just not as many hours as I used to. And I'm well aware that there are other moms out there, other families that who will never get any relief from their problems, their therapies, their bills, their stress, their anxiety, and their worry, and just the daily grind of caring for a medically fragile child. There will be no relief for those families. And I want to do anything I can to help these families. And so obviously Greg and I are involved with Ronald McDonald House. It's something I feel very strongly about, even though they are not a religious organization. When I lived there, I saw God working, and I felt God's presence there. And we volunteer here at the one in Lexington, and I see God working there every day in the hearts and the lives of the families there caring for their sick children. And it's a privilege to be a part of it. And I'm going to give some shout outs now. So if you want to know how to get more involved with Ronald McDonald House, how to donate or volunteer, come find me after. I'd be glad to talk to you. Another organization I spend time for, I volunteer for, is called To Be Friends. We're a national nonprofit, and we make bears adapted to special needs for children. So the bears have a trach or a G-tube, a scar, a central line, a PICC line, whatever they need to give comfort and educational training to the children. And I get to make the bears, and it doesn't require very much skill in sewing, which is good because I don't know. But we always need volunteers, and we always need donations. And this is something I started doing for Ellis when she was a baby and got her trach and her G-tube. She had a baby doll with a trach and a G-tube, and that was such a big help for her. We've also helped with fundraising for Lexington Hearing and Speech Center, which has helped us tremendously throughout the years, and the Lexington Dream Factory, which provided a dream trip for Ellis a few years ago, which was amazing. So I can give you information about either one of those. And the most important thing we spend our time on is Greg and I volunteer here at Forks in the church, several committees, several different departments. And I'm very involved in the children's department. And to me, that is a passion for me right now, because I feel like I want to help create the environment where Ellis can grow up feeling loved, supported, understood, and where she can grow in the grace of Jesus Christ without feeling that she is less than anything. And everyone here embraces her and loves her. And I'm so excited about being a part of the children's department here. And I can give you more information about that if you want to volunteer. So I've gone over my time, so I apologize. But I feel like in organizing my thoughts for today, I had so many things that I wanted to share with you all that it wouldn't all fit. But I want you just to remember one thing, that no matter your situation, no matter how hopeless you feel, no matter what is consuming your thoughts, no matter what seems impossible, God has a plan. He'll meet all your needs. And if you trust him, it will turn out better than you could have ever imagined. So, thank you very much.